everyone. Welcome to our third episode of Behind the Graph with Shane, our epidemiologist over at Teton County Health Department. My name is McKinley, and today we're going to be talking about COVID-19 variants, why they matter, how we can protect ourselves, and why we should be concerned. So we'll jump right into it with our first question. So Shane, what are COVID-19 variants? Do you mind explaining them?
Yeah, so variants essentially emerge when you get changes to the genetic material of the virus that accumulate over time. It leads to kind of distinct lineages. It's something that happens to all infectious diseases. They all gradually change over time. And then with the virus that causes COVID specifically, there's been lots of distinct variants that have already emerged, and most of them aren't really of any more concern than any others. But in Teton County so far, we've detected two variants that are of increased concern, and that's B.1.1.7, which was first detected in the UK, and then B.1.351, which was first detected in South Africa.
All right, and so why are we concerned about these different kinds of COVID variants?
Yeah, so with the B.1.1.7, the concern so far is really that it appears to be more transmissible, and then there's also some studies to suggest that there's a higher mortality rate. A lot of research that came out of the UK was showing an increased transmission rate of 30 to 50%, which is actually a pretty substantial increase from other variants that we've had circulating in the US. And it actually, while the UK was on a lockdown, the number of cases attributable to B.1.1.7 actually increased, and it took a lot of pretty intense control measures to try to get that under control.
Wow, yeah. And even the fact that they're more transmissible, that just raises concern for, doubling down on your personal protective behaviors.
Yes, so in addition to the increased mortality rate, if you have increased transmission and just more cases, you're going to put more strain on the hospital system with more people going in there. So it is something of concern for sure. And then with the B.1.351, which was first detected in South Africa, the concern there really is that it has some mutations that seem to reduce the effectiveness of some of the vaccines and potentially allow it to evade immunity. So there have been cases of people who've been reinfected with the B.1.351 variant after getting infected with a different variant earlier on.
Wow. Ugh. All right, and so that leads in perfectly with our third question. What can we do to protect ourselves from these different kinds of variants?
Yeah. So the new variants of any sort are going to be more likely to emerge if the virus is given more opportunities to infect other people. So really to help protect yourself and to help prevent new variants from emerging in the future, it's really all the same stuff you've been hearing. Masking, distancing, avoiding crowded places, all those are going to be really important. In addition, getting the vaccine when it's made available to you is going to be absolutely important and critical.
All right, Shane, is there anything you want to mention about the COVID-19 variants before we close?
No, just the same old reminder. Everyone keep doing what needs to be done to protect themselves and their community. It's something that is of concern, these new variants. So really doing whatever we can to prevent their further spread and the emergence of new variants going forward is going to be absolutely critical.
Yeah, absolutely. Thank you for mentioning that. All right, well, that will close us for today's episode. And just a friendly reminder, you can submit any questions or topics that you want covered for our next video, which is March 26th. And we look forward to seeing you guys. Thank you.